Hey everyone, I get a lot of questions on what is regenerative medicine, what do I specialize in, and why do I believe in stem cells so much? Stem cells are our body's undesignated construction workers. They run throughout our entire body. If you break a bone, they go to that bone and say, hey, we need to create bone and fix this bone. You get pregnant, they go to the fetus, say, we need to make this a viable fetus. Well, what about my knees? My knees hurt. I'm sorry, I'm not called there. That's where doctors like me come in and say, okay, you know what, with knees, 2 shots of umbilical cord stem cells have been proven to relieve your pain, improve the flexibility and motion of your joints within a period of a few weeks. Most people will begin to feel better within a few days, but it is a 6 to 9 month rebuilding process. Everywhere throughout the body, those joints, the arthritis, pain in your joints, whether you have rheumatoid arthritis, can be resolved as far as the pain goes with 1 or 2 stem cell injections. Europe has been telling us for over 40 years, stop doing knee replacements, stop doing shoulder surgery, stop doing foot and ankle surgery. It's nuts. With 1 or 2 stem cell injections, you can not only relieve the pain, but repair the muscles. If you have a rotator cuff tear, 1 injection has been proven, as long as the tear is less than 40%, to repair that tear. But more importantly, resolve that pain. Same thing with any joint in your body, whether it be elbows, wrists. It's also proven for carpal and tarsal tunnel. 1 injection on the radial nerve or the tarsal nerve, the posterior tibial nerve, can help reduce your symptoms greatly from having carpal tunnel or tarsal tunnel. You have arthritis anywhere in your body, whether it be the knees, the shoulders, any joint, your foot, ankle, top of the foot, bottom of the foot. 1 shot can resolve that pain, and it lasts for years. Not just an internal temporary Band-Aid like steroid. I do believe in using 1 steroid injection as a diagnostic tool. If you have 1 steroid shot in there and yeah, it took my pain away for a bit, but then the pain came back, then we know that that's the joint that's causing the issue. 1 injection of stem cells will usually resolve that for a long period of time. When it comes to the knees are a bigger joint. The knees require a minimum of 2 injections given at the same time. 1 in the joint, 1 on the outside of the joint to help strengthen the muscular and ligamentous tendons. The injection on the inside of the joint will help to rejuvenate the cartilage, which is degrading, which is what arthritis is, as well as to puff up the meniscus, which is our shock absorber. In about 20% of the cases with knee pain, within about 3 to 4 months, you may have to repeat the stem cell injections in order to get the optimal results. But I find for 80% of the people, they come in within 6 weeks for a follow-up and say the same thing. I'm 70, 80, 90% better. Why'd that doctor tell me I need a knee replacement? Because we are an insurance-based, surgical-based society. We do not cover, practice, preach, or teach anything about regenerative medicine. But it's not all in all that good out there either in the other countries, because I see people from all over the United States. I see people from Canada, Mexico, Europe. And I used to ask them, why are you coming over here? You have universal health care in your country. And the story was always the same. I jumped through hoops for 2.5 years. They finally okayed me for the stem cells. Now I'm on a 3-year waiting list before I can get the injection. So it is what it is as far as that universal health care goes. But instead of having surgery, instead of being laid up in pain, on pain pills, going through physical therapy, I have always believed that let's keep you off of drugs, out of surgery, on your feet, and get you pain-free. 2 injections in your knee, 1 in every other joint. You will notice a huge difference. And if you're one of the 20% where you still have some residual discomfort because maybe you're only 50 or 60% better within 3 months, then I recommend doing a second set of injections into that joint in order to help get us up to the 80, 90 plus mark. If you have any questions, Mid-Ohio Foot and Ankle.